Hey guys, I'm Ariannes. Welcome back to another video. So today I'll be giving you guys year 3 MBBS survival guide, and I'll be talking about like my year 3 experience, some tips, some high-yield topics, all that. So let's get started. So year 3 basically to me it's a year of transition, and it's a year where you're jumping from pre-clin to clinical years, which can feel a bit overwhelming, I must say, from my experience, but it can be done. And I hope that this helps you guys. So yeah, so for me, as I said, in third year, like I was a bit anxious because myself, oh god, clinical time now, I'll make a manage. So I was a bit anxious, right? And I remember for me personally, like I didn't like my pre-clin years. Like I hated pre-clin. I wanted to leave my school based on pre-clin because I'm like, this isn't going well. Like I don't like this. But I started my clinical years and I was like, wow, this is exactly why I did this. Like when I went to third year, I was like, yeah man, that's when I fell in love with medicine. That's when I fell in love with all that medicine is, because what I saw or what I was reading from pre-clin was actually in front of my eyes, and I was like, wow, look at this. I'm a big girl now. I'm in the hospital. I'm doing stuff. But it is a change. It's an adjustment from you being in what I call it LT3, LT1 to being in the hospital in your white coats. It is a change, right? For the courses for year 3, from what I remember, you have aspects of family medicine, you have medicine like internal med, and you have surgery, right? I started with aspects of family medicine, and that's split into child health and psychiatry, I believe. So for child health, I went to Bustamante, and personally it wasn't an extremely hands-on experience because we're dealing with kids here. It's not a case where you can just poke and prod as you please. They're children, right? So what we mainly focused on at Busta was like history taking. So we spent most of, if not all of our time in third year at Busta learning how to take history, which is important because a good history will get to the answers that you want. So it's good. So you spend most of your time talking to mom or daddy or guardian or parent or whoever and asking them questions about the baby or the child. So most of the time is spent doing that. Most of what is done at Busta, it's mostly observation. So you tend to be observing like suprapubic aspirations, you're observing lumbar punctures, etc. These aren't things that you're going to be doing or things that you're going to be expected to carry out. You're just observing, right? What they expect of you is for you to be taking good histories. And the more you take histories, the more, you get good at it, as with everything in life. So that was Busta. And they don't expect for you to be examining the babies. That is not what you're there for. That's more so in final year. What you're there for is to take history. So use the time to take histories. Tell them to your final years. Tell them to the doctors, like, take histories and make people listen and correct you, because you can only get better from there. As child, for psych, I don't remember exactly how psych went, to be honest. But I remember that it wasn't too tedious, which I liked. And I remember us going to like Bellevue and other, like we had some off-site visits, I remember those, but it wasn't anything too tedious. And personally to me, aspects of family medicine is one of the less tedious rotations of third year, or maybe the least of third year. So there's that. And yeah, but that was my experience with it. For my exams, I remember that being my first OSCE, and boy, I'm really nervous. You got history taken for that, and I don't remember if we got counseling, to be honest. I think we got history taken, and we got like some short answer questions where you had something about some asthma nebulizing and all that. I don't remember, but it was my first OSCE and I was quite nervous, but I passed. And yeah, so there's that. And then after that, I did, at the end, I'll discuss the high yield topics with you and all of that. But yeah, and give you some more tips and whatever. But yeah, so after that I did surgery, and guys, surgery was my favorite out of all three. Like, I mean, I don't want to become a surgeon, but that rotation was well put together, 10 out of 10. I had a very, very good experience. So it split into a specialty and gen surge. So I started off with my specialty, and that was urology, and it was actually really good. Like, it was very, very, very hands-on, and so I got to put in catheters, I got to help with like prostate biopsy, I got to draw blood, like I got to scrub in and all that. So it was pretty hands-on, and people always say, oh, you were not hands-on, but I had a very hands-on experience with urology at UA, right? So I actually had a good experience there, and the doctors were nice, they were very willing to teach, which I appreciated a lot. So there was that. What they had expected of you was, take your histories, present them when you can, all of that. So again, history taking is important. So take the time out. Even though it's a specialty, things can still come back in your end of graduate exam. So take the time out to take your histories, be diligent with it, and learn how to make your histories better. Present them when you can, And yeah, and same goes for gen cert, like do your histories, present them when you can. And for me, I did gen surge at Cornwall Regional Hospital, and it was so good. We had clinic, it was really good, and we got, of course, taught by the Dr. Frey, and it was 10 out of 10. But yeah, Cornwall was also very hands-on, and Cornwall was the first time when I actually, left home. I've never been away from home before, and it was my first time, and it was a very, very good experience. Very hands-on. I took histories, got to present them, you look at x-rays. It was pretty good. But surgery, point to note, like, it's really good. Not even really good, but you should know your procedures. Like, it's very important for you to know your procedures. In surgery, what they expect from you is for you to know your examination. So like your lower limb exam, your thyroid exam, breast exam, etc. So know your examinations, know your procedures, because for your OSCE you'll be getting, exam or whatever. So know all of those, because it's very, 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 very important. Because even in terms of a procedure, because for me, I think I got, like, they were saying, I was at Cornwall when I sat my exam, and they were saying, all right, percuss this patient abdomen, and he was dull in his bladder region. So he was, and then him asked me, what is this or whatever, some more urinary retention or whatever, and then we start talking about Foley catheter, and I have to tell him how to put in the catheter and all of that. So it's good to know your procedures and how to do them, and it's good to know your indications, contraindications, complications, all of that, because they can and they will ask you. Don't think that they won't. They can and they will ask you. So yeah, so know those definitely. But yeah, the MCQ wasn't bad for surgery, and my OSCE wasn't bad either. I got a lower limb exam, and the patient had critical limb ischemia, and I got a catheter thing from technical station, right? So yeah, that's my experience with surgery. Very hands-on, very good, very well put together. And the thing with surgery is it's very finite. Like, there's only so much detail we can ask. Like, it's very finite. It's not medicine, so there's only so much that they can ask, and there's some high topics that they'll always bring, so like breast, venous insufficiency, PAD, they'll always bring those stuff, whether in the form of OSCE or on the MCQ. So pay attention to those high yield topics. And yeah, then for medicine now, again, it's split into the specialty as well as the general. So I started on general first. So I went to KPH. Personally, I hate KPH. I do not like it. It's not the people, but like the environment. I cannot take the environment I just can't. I cannot. But in terms of teaching and stuff, like it was okay. I mean, they went through the examinations with us because you know on medicine you have to know your exams, so know your CNS, your CPS, recipe exams, etc. So they went through the exams with us. We also had tutorials, so that was good. And yeah, I mean, on medicine is when COVID came for me, so nobody really gets a full-on medicine experience. And to be honest, we can't say what a third year medical OSCE is like because I never sat one. My first med OSCE was in final year. So what I really expect of you is for you to know your exams, have good differentials, but I can't really give a good synopsis because I never had a full experience. But yeah, now let me run you guys through what a regular clinical day would look like for you. So you go to school, well, yeah, school. I was about to say work. You go to school at like 8 a.m. and you have rounds. So for rounds, best believe, alright, first of all, rounds doesn't have to be at 8 a.m. Rounds is dependent on what time the doctor comes, but it's always good to be at school from 8 or whenever. Not me though, I wasn't really at school at 8. But anyways, so rounds, set this from me. Take the time to know whose patients are on your team so that you can know what the patients have, know how to manage them, know the pathophils, etc. So when they come around, because I know they're gonna be like, doc, what is this? You know, why is that? Okay, all right, then why? They're gonna ask you questions. So ensure that you are aware or have some knowledge of the patients and what they have, etc. Because it will help you, and it will look like you're doing something, you know. You have to kind of treat them sometimes. So yeah, so definitely take the time out to do that. That's one advice I have for you. I take the time out to do that. So after you done rounds and thing, and the thing is, guys, rounds, before you continue, rounds is important. Don't miss it. Take the time out to go. And most of what you learn is coming from rounds. Most of the time spent there, what you learn is coming from rounds. And sometimes they'll bring back stuff from rounds into your exam. So spend the time to go to rounds, right? Very, very important. And don't be afraid to say anything. Because guess what? If you talk and you say something stupid, it wouldn't be the first time you say something stupid, it wouldn't be the last time you say something stupid. So just talk and done, right? I know that it may seem daunting, but honestly, just talk, because that's the only way that you will learn. And a part of your clinical years as well is talking. So it's important to know how to talk as well. So spend the time and try talking, right? And it's easier said than done to not be afraid, but try not to be afraid. You do have knowledge. They know that you don't know everything, that they know that you're learning. So take the time out and actually, you know, talk. Just try and talk, even if a foolishness talk. But if you say it now and get it wrong, then you're going to exam and things that's how it go. You get me? So yeah. And after rounds now, you may either have tutorials, or it might be a case where, you know, you're trying to get your procedures done. So I mean, that's kind of your regular clinical day, kind of. But yeah, so now for 5 tips that I have for you guys. So no man, that video jam pack. It's so much stuff I get. No stuff. Anyways, so number 1, I would say to you guys, definitely don't be too hard on yourself. It's a year of transitioning. It's a year of new things, you know. So don't be too hard on yourself, right? You will get the hang of it. Allow yourself time to make mistakes, because you will make mistakes, you know. And just don't be too hard on yourself. It is started. It's the year where you're transitioning. So just don't be too hard on yourself, right? Be loving and give yourself grace and time to actually transition. Number 2, what I'll say to you is definitely get a study group and start practicing stuff from now. Practice talking, practice your exams, like practice all of that in your study groups. Because guess what, having your study group, having them correct you, having them say, yo, so this way cannot sound better, like that's how you learn and grow as well. And that's how you kind of break out of shyness as well, when you practice talking. You get me? So get a study group, definitely. Really, what I would say is to ensure that you don't get burned out. So it can feel like a lot make sure you get rest. You can feel like say you can't get no sleep, like say, Lord God, me not have no time, but make the time. Please make the time, get some rest, relax, go out, do some leisure activities, but do not get burnt out. Burnout is real. Remember I tell you, burnout is real. It's definitely real. Don't fall in that trap. And it's easy to when you're transitioning and you're trying to keep abreast of everything. So please relax and get rest. For number 4, I would say definitely be enough. Doctors like enough, right? So them love when enough and you want, doc, what are you doing? Let me help you. They love it. And the thing is, the more they realize that you're interested in, the more that they'll actually help you, right? And the more that they want to teach you. So be enough and don't be afraid to be enough. Enough gets you places. I'm not enough person, but I realize that enough gets you places. So sometimes I will try and be enough, you know? But yeah. So there's that. So for number 5, I would say definitely attend ward rounds. I feel like they're very important. They may be long and drawn out and boring sometimes, but especially in 3rd year, I feel like it helps you. So definitely go and make a note, because I said sometimes it does come back. And remember guys, common things are common. So spend time and enter, those common things back and front, because those common things are gonna come whether by OSCE or by or by MCQ, right? So let's know that common things are common, right? So yeah, and those are my 5 tips. So yeah, the high topics for each rotation for child health, I would say no rashes, no febrile seizures, no no rashes, no febrile seizures, no sickle cell, stuff like that. For surgery, no diabetic foot, no PAD, no venous insufficiency, no BPH, urinary retention, breast cancer. For medicine broad, like too broad. But yeah, I do have some material that I can send you guys. So if you want some, just hit me up at Ariannes _ on Instagram and I'll send them to you. But yeah, I hope you guys learned something from this video. I really tried to give you guys a survival guide. But yeah, thanks for watching, and don't forget to like, comment, share and subscribe. Bye guys.